My name's Neil Jain. I'm a consultant orthopaedic surgeon with a specialist interest in sports injuries, so that's not one specific joint. I tend to focus on shoulder and knee injuries and keyhole surgery off that. My passion is regarding sport, and I've been lucky enough to work with many international sports, men and women, and recently at the Olympic Games, a number of my patients took part in the Olympics, some even winning medals, and that filled me with great pride. On the back of that, I've recently completed a sports medicine diploma with the International Olympic Committee and a football medicine diploma with FIFA, the international governing body of football. With regard to the shoulder, I see a lot of sports injuries, but there's three really more common ones that I tend to see. Patients who have a shoulder dislocation, patients who have a tear in the rotator cuff, or patients who have an issue at the collarbone or acromioclavicular joint. All three can happen with contact sports or a fall, and all three present with pain and subsequently instability, weakness or difficulty moving. And all three I would strongly recommend seeing a specialist early in order to help plan appropriate treatment, because while a lot of these injuries can be treated with physiotherapy, if surgery is needed, then the earlier we intervene, the better the results. Another area of my practice is the knee, and as you'd expect, knee injuries are very common in sport. We're probably all aware of the ACL tear, the cruciate ligament tear. We know that's very common in football, but just as important is the meniscus tear, the old cartilage tear where you would have had keyhole surgery and removal of the cartilage. Well, now we try and retain the cartilage or the meniscus because we know it helps decrease the rate of arthritis later. The other common injury that I tend to see is a tear of the quadriceps tendon or patella tendon. And realistically, any one of these three injuries, if you're a high-level sports person or looking to return to sport where there's a lot of running, twisting, changing direction, surgery is often indicated there. A final aspect of what I can offer is joint preservation. Now, as a principle, this is something we've not really seen a lot of in the UK traditionally. And rather than just a steroid injection, a knee arthroscopy or a knee replacement, we now have so many other options ranging from vitamin supplementation, knee sleeves, knee braces, more suitable regenerative medicine type injections in a bid to try and provide cartilage with a long-term health in order to help prevent knee replacement. People often ask, how soon should I be considering joint preservation? Well, really the earlier the better, but often it's when people start feeling pain. I'd really recommend coming to see somebody with joint preservation ideas if you want to try and avoid a knee replacement for as long as possible. So if you have any issues with your knees or shoulders or any sports injury, I'd be more than happy to see you. Please contact me or Euxton Hall.